Hello professionals, this is Dr. Saad, and as you know, we are recording series of lecture for pharmacists who are going to appear for international equivalency exam. In previous video, we talk about protein senses inhibitor drugs, and now we will conclude this chapter's summary and move on our accordingly. So let's begin our topic without wasting more time. As long as the clinical applications are concerned, infection caused by the Mycoplasma, Chlamydia, Rickettsia, some spirochetes, malaria, H. pylori, and acne. The drug class which is used for is the tetracycline, and drug include is named as tetracycline, doxycycline, minocycline, tigacyclines. And keep in your mind that doxycycline is also used for the management of community-acquired pneumonia and exacerbation of bronchitis. And as long as its toxicity is concerned, it causes gastric upset, hepatotoxicity, photosensitivity, deposition in the bone and teeth. Macrolide is used basically for the community-acquired pneumonia, pertussis, cyanobacteria, and chlamydial infections. And examples of these drugs are erythromycin, clarithromycin, azithromycin, and telithromycin. It causes toxicity relevant to gastric upset and hepatotoxicity and QT prolongation. These are the side effects. As long as the issue is concerned with the skin and soft tissue infection and anaerobic infection, clindamycin is most relevant drug. Its side effects are gastrointestinal upset and C. difficile colitis, or this toxicity involved in its use. And infection caused by the staphylococci vancomycin resistant strains. It is being treated by the use of quinopristine and delfapristine, and the toxicity related to these drugs is infusion related myalgia and arthralgia. These are the side effect of toxicity of clindamycin. And when there is an issue, as long as the chlorphenicol is concerned, it uses rare in developed worlds because of a serious toxicity, and its toxicity is dose-related anemia, idiosyncratic aplastic anemia, and gray baby syndromes are among its toxicity. That's why it is rarely recommended in developed worlds. And if as long as the infection caused by methicillin resistant streptococci and vancomycin resistant strain and trinococci are concerned, it is managed by the use of drug that is known as linezolides. Its toxicities are dose dependent bone marrow suppression and nephrotoxicity, optic neuritis, and serotonergic syndrome occur when co-administered with the serotonergic drugs. Like if it is administered with the serotonergic drug, it causes serotonergic syndrome. And this linezolide is also used for the treatment of, or approved for the use in skin and soft tissue infections. So it is a brief summary of the previous chapter. So let's begin our next topic from the chemotherapeutic drugs, that is the aminoglycoside and spectrinomycin. As you know that as long as the mechanism are concerned, this drug binds to 30S ribosomal subunits and initiates three steps that leads to the cell death of microbes. It either interfere, misreading, or break up the polysomes activity. That's through these steps. After binding to 30S subunits, it controls the microbial growth, and antimicrobial action is achieved. So let's resume our points that is most relevant to the exam. As long as the tobramycin and spectromycin is concerned, these both drugs are most resembled with each other, and both are aminoglycoside. Tobramycin is structurally similar to the gentamicin, and tobramycin makes hearing loss by affecting both auditory and vestibular branches of 8th cranial nerve, and may develop effective ototoxicity damage and may be reserved for up to half of cases. So the main side effect of this tobramycin is the ototoxicity and auditory and vestibular damage of 8th cranial nerves, due to which it causes hearing loss. And keep in mind that this hearing loss becomes more. There is a possibility of hearing loss if dose is administered beyond 5 days. Below 5 days, there is a less risk of this side effect. So it was all about this the tobramycin. Next is about the spectrinomycin. Spectrinomycin is used for the treatment of gonorrhea in patients sensitive to penicillin and with resistant gonococci. And gentamicin is most effective against Pseudomonas aeruginosa and against G bacteria in general, and it active against gram-negative E. coli. And gentamicin is more effective in alkaline urine, but in alkaline environment of urine it is most effective. And but on the other hand, nitrofurantoin tetracycline is more effective in the acidic environment of urine. So its activity depend upon the pH of urine. So next point is about the aminoglycoside, and it is contraindicated with the furosemide, and it exhibits the concentration dependent killing and have a significant post antibiotic effect. So if creatinine clearance is greater than 60 ml per minute, then 5 to 7 mg per kg of gentamicin and tobramycin is recommended, and 15 mg per kg for amikacin is recommended. These are the dose recommendation with reference to the creatinine clearance. Combination with diuretics or other nephrotoxic drugs like vancomycin and amphetamine is avoided if possible, because there is a risk of nephrotoxicity synergism. So next point is about the spectinomycin. Again, its dose range. Its spectinomycin dose is 15 mg per kg, and it can be recommended for up to 1 gram per day. And for children, its dose is 20 mg to 40 mg per kg for children. These are the dose ranges for the children, that is of spectinomycin, that is the 20 mg to 40 mg. And this was all about the point are relevant to the aminoglycoside and spectinomycin. So let's move on our summary. As you know that as long as the skin sepsis caused by aerobic gram-negative bacteria, synergistic activity in endocarditis caused by streptococci and staphylococci and enterococci. If these applications are concerned, gentamicin, tobramycin, amikacin, streptomycin, neomycin, and spectinomycins are the drugs which is most relevant for this. And as long as their toxicities are concerned, these drugs causes ototoxicity which is irreversible, and nephrotoxicity is reversible, and neuromuscular blocker actions are some of its side effect. So these were all about this aminoglycoside and spectinomycin and their relevant chapters. So let's move on our next topic, that is the next chapter, that is about the sulfonamide, trimethoprim, and quinolones. As long as their mode of actions are concerned, sulfonamide inhibits the synthesis of dihydrofolate, and trimethoprim blocks the production of tetrahydrofolate, which are the steps involved in the purine and ultimately DNA synthesis. Or you can say these drugs interfere with the synthesis production of folic acid, which ultimately interferes with the synthesis of DNA, and ultimately in the end our end target of microbial growth production will be inhibited. Fluoroquinolone, other chapter, that is the quinolones. Fluoroquinolone block bacterial DNA synthesis by inhibiting bacterial tropoisomerase 2 and tropoisomerase 4. This is also known as DNA gyrase. So fluoroquinolone inhibits the DNA gyrase synthesis, and through this way it inhibits the production, inhibits the growth of microbes, and our chemotherapeutic action is achieved. So let's move on our points. As long as the spilus is concerned, spilus is treated with penicillin G, quinolones, and chloramphenicol. These are the drugs of most relevant for the treatment of spilus. That is the penicillin G, quinolones, and chloramphenicol. Quinolone side effect is CNS stimulant. Quinolone causes CNS stimulation. Drug of choice for E. coli is cotrimoxazole, and cotrimoxazole is also used for the treatment of toxoplasmosis, pneumonia, and narcoidiosis. So ciprofloxacin is next point is about the ciprofloxacin. Ciprofloxacin is not taken with the urine alkalinizers. Those agents which alkalinize the urine, it is not taken with ciprofloxacin is not recommended to take along with them. Oral absorption agents, like there are some sulfonamide drugs that is orally absorbs. Its examples are oral absorbable agents of sulfonamides are sulfamethoxazole and sulfamethoxazole and trimethoprim in combination. And the non-absorbable agents are sulfasalazine. It is widely used in the ulcerative colitis, enteritis, and other inflammatory bowel diseases. And silver sulfadiazine, less toxic and topically sulfonamide, and prefer to use for the prevention of infection associated with the burns. So silver sulfadiazine is used topically, and non-absorbable is used for the ulcerative colitis, and absorbable is used for the management of other antimicrobial agents, as we are talking about them. Sulfonamide can cause optical anemia. Sulfonamide can cause aplastic anemia, granulocytopenia, thrombocytopenia. It may provoke hemolytic anemia in G6P deficiency patients. So it take near the end of pregnancy increase the risk of carrying near the end of pregnancy it increase the risk of carrying sorry Carni Truss sorry I maybe I its pronunciation is Carnitrus syndrome, Carnitrus in the newborn. So its take near the end of pregnancy increase the risk of Carnitrus in the newborn. These are the side effects relevant to sulfonamide. It causes anemia, granulocytopenia, thrombocytopenia, and provoke hemolytic reaction in G6P deficiency, as well as carnitrous in newborn, risk of carnitrous in newborn in the end of pregnancy. Trimethoprim dose is 100 mg twice daily. It is used for the treatment of urinary tract infection. Silver sulfate, methoxazole, and trimethoprim used in combination with a dose of 800 mg to 160 mg every 12 hours for the treatment of urinary tract infection, prostatitis, and uncomplicated skin and soft tissue infection. And its dose is reduced for prophylaxis in the treatment of women, prophylaxis of urinary tract infection in women, and its dose is recommended for that is 400 by 80 mg of sulfamethoxazole and trimethoprim, and one tablet 3 times weekly is recommended in UTI in some women for the prophylaxis. Trimethoprim dose for the children is 8. Trimethoprim is recommended 8 mg per kg per day, and sulfamethoxazole is recommended 40 mg per kg per day every 12 hours for the children. Its dose for the children is that. As long as there are some fluoroquinolones and their doses are concerned, there are some drugs that is the fluoroquinolones. Its drug examples are ciprofloxacin, gemifloxacin, levofloxacin, moxifloxacin, norfloxacin, and ofloxacin. Their doses are concerned. Ciprofloxacin is recommended 500 mg twice daily, and gemifloxacin is recommended 320 mg once daily, and levofloxacin is recommended 500 mg once daily, and moxifloxacin is recommended 400 mg once daily, and norfloxacin is recommended 400 mg twice daily, and ofloxacin is recommended 400 mg twice daily. And these are some about the doses of fluoroquinolones. And next point is about the dose adjustment for moxifloxacin is not necessary for renal impairment because it is metabolized by the liver. So in case of renal impairment, moxifloxacin can be recommended because it is not cleared through the kidney. Fluoroquinolones except moxifloxacin is used for urinary tract infection, bacterial diarrhea, and skin and soft tissue, bone, joint, inter-abdominal, and respiratory tract infections. Except moxifloxacin, these are the sites of infection which is controlled through the fluoroquinolones. The examples are UTI, bacterial diarrhea, skin, soft tissue infection, joint, intermuscular, inter-abdominal, and respiratory tract infections. Ciprofloxacin is drug of choice for the prophylaxis of anthrax, and according to USA, levofloxacin is all USA FDA also approved levofloxacin for this indication, but ciprofloxacin is used as considered as a drug of choice for the anthrax. And next is about the urethritis and cervicitis. These are two conditions, urethritis and cervicitis. It is managed by the use of levofloxacin and ofloxacin. Levofloxacin and gemifloxacin and moxifloxacin is used for the lower respiratory tract infection. And last point is about the fluoroquinolones. Just keep in your mind, it is a guideline that fluoroquinolone should be reserved for the patient with who don't have alternative option, particularly in less severe infections such as upper respiratory tract infection and uncomplicated cystitis. So uncomplicated cystitis and upper respiratory tract infection, fluoroquinolone should be reserved as an alternative option for these two type of infection, that is the respiratory tract infection and uncomplicated gas cystitis. So it was all about this chapter and important points. So let's talk about its summary and we will conclude our recording relevant to this topic. As you know that as long as the clinical applications are concerned, urinary tract infections, soft tissue infection, bone and joint infection, and toxoplasmosis, nardiosis are concerned. The drug which is used for these microbes and indications are trimethoprim, sulfamethoxazole in combination, sulfadiazine, trimethoprim, pyrimethamine, and pyrimethamine pyrimethamine sulfadoxazine in the combination. The main thing is that trimethoprim sulfamethoxazole are used in combination for the management of urinary tract infections, soft tissue infection, bone and joint infection, and pneumonia, and toxoplasmosis and narcodiosis. As long as their toxicity is concerned, it causes fever, rashes, bone marrow suppression, hyperkalemia, and nephrotoxicity. Next, the use of fluoroquinolone. It is used for the urinary tract infection, gastrointestinal infection, anthrax, and osteomyelitis, and it's the drug involved for the management of these situations are ciprofloxacin, levofloxacin, moxifloxacin, and chemifloxacin. As long as toxicity of this class is concerned, it causes gastrointestinal upset, neurotoxicity, and tendonitis. These are the examples of toxicity of this concern. So I think so it's enough for today. Thank you so much for listening. And in upcoming video, we will record remaining chapter of chemotherapeutic drugs, and we will conclude our topic accordingly. Thank you so much.